What lung cancer signs does a physical exam detect? Imagine you're sitting in the doctor's office, and they start checking your lungs and body carefully. A physical exam can reveal some clues that might suggest lung cancer, but it's important to remember that many early signs are subtle or not present at all. During the exam, a healthcare provider listens to your lungs with a stethoscope and might notice decreased or absent breath sounds over certain areas. This can happen if a tumor blocks part of the airway or replaces normal lung tissue. They may also observe rapid breathing, known as tachypnea, or notice that your oxygen levels are lower than normal, which indicates your lungs aren't working as well as they should. Sometimes, a doctor might find a low-grade fever, which can be a sign of an infection or inflammation related to the cancer. Finger clubbing, where the tips of your fingers become thicker and wider, is another sign that can be linked to chronic lung diseases, including lung cancer. If the cancer has spread to the bones, you might experience bone pain or even fractures in areas like the ribs, spine, pelvis, or thigh bones. Shoulder pain can also be a clue, especially if it's caused by a tumor at the top of the lung, known as a Pancoast tumor, which can press on nearby nerves. In some cases, the exam might reveal swelling in the hands or feet, or neurological symptoms such as weakness, paralysis, or cranial nerve problems if the cancer has spread to the brain or nerves. Pale skin can also be observed if the patient develops anemia, which sometimes occurs with advanced cancer. Vital signs like heart rate and blood pressure may be normal in early stages but can become abnormal if the disease progresses, such as rapid heartbeats or low blood pressure. It's important to understand that many of these signs are not specific to lung cancer and can appear in other illnesses. Often, physical exam findings are only present when the disease is advanced. That's why imaging tests like chest X-rays or CORT scans are essential for detecting lung cancer early, especially since many early tumors do not cause noticeable physical signs. When physical signs are found, they usually lead to further testing, including tissue biopsies, to confirm the diagnosis and determine the extent of the disease. In summary, a physical exam can help identify signs such as abnormal breath sounds, finger clubbing, bone pain, and neurological symptoms that might suggest lung cancer or its spread. However, it is part of a broader diagnostic process that relies heavily on imaging and tissue sampling. For those at high risk, such as heavy smokers or individuals with a family history, regular screening with low-dose computed tomography scans can help catch lung cancer early, often before physical signs even appear. Always consult healthcare professionals for personalized advice and diagnosis.